I'm joined by Dr. Joyce Locke from Southwestern Public Health. Thanks for checking in again, Dr. Locke.
Good morning, Shane. Good to be with you.
We currently have 10 active cases in our region, and most of those are staff from a long term care home in Ingersoll. Any update on how the staff and residents are doing?
So they're all doing well. The good news is that none of the residents got the infection. The infection was limited to some of the staff only. And so, what we surmise happened there was that the staff were diligent when they worked with the residents and wore their masks and their PPE, which is a good lesson to all of us that if we wear a mask, we can make a big dent in spreading infection around. So, probably what happened was when the staff were together, perhaps over a lunch or a break, and they had to take their mask off, that's when the infection started to spread. And often when we're together and we eat, we forget about being 6 feet apart. So the other good news is that if we stick to sticking 6 feet apart and we wear a mask, we can really cut down the spread of this infection.
Well, that's great news for the residents there. Um, and now the province has opened up testing to more people. Who can be tested now?
So anyone who thinks that they have symptoms of COVID-19 can get tested. On our website is a long list of possible symptoms. There are the classic symptoms such as the cough, the fever, the trouble breathing. But there's also, as we learn more about COVID, a bunch of other possible symptoms. So if you think you have COVID, we ask that you go to our website and check the symptom list. And then if you have some of those symptoms, you can go and get tested. The other group that can get tested is if you are a contact of someone who has been diagnosed with COVID and you're wondering if you're getting it, then you can go and get tested as well.
And can you clarify what a negative test means?
So that's a good question. Most people think if they have a negative test that they're scot-free and they don't have to worry about COVID. And that's actually not true at all. So a test is a snapshot. It's a picture of an instant in time. It's sort of like taking a picture of when it's sunny and then a minute later the clouds can come and it starts to rain. So it's only of that particular instant. So you could have actually been infected with the virus, and the virus is what we call incubating or starting to spread inside your body, but you're not yet shedding it through your nose and your saliva. So we test your nose or the back of your throat for the virus, and it could be that even though the virus is cooking inside your body, it hasn't shown up in your nose yet, and you get a test that's negative, and a day or two later you start to shed. So then you think, oh, then you're at risk for spreading it around because you thought, oh, I'm negative. So a negative test can sometimes mean that you don't have the infection, but it can sometimes mean that you're still cooking the infection. So we do recommend, even if you've been in contact with someone who's had COVID and then you go to the assessment center and you get a negative test, you still need to stay and self-isolate for the full 14 days, which is the longest incubation phase, or the longest time it'll take for the virus to start shedding from your nose or your saliva in your mouth.
Okay, I understand. And now we have 3 testing centers in our region.
Yeah, we did that specifically to make it easier for all of our citizens to get tested. So we now have a test assessment center at the St. Thomas Elgin General Hospital, one with the Woodstock General Hospital, and one also at the Tilsonburg Hospital.
And last week you released an epidemiology chart about reducing the surge. Can you explain those figures?
Yeah, so that was an important figure, and we get people to go to our Facebook page to see it. But it essentially shows that if we stop doing what we were doing, which is doing the physical distancing and washing our hands and staying home when we're sick, that the virus it could start to spread very quickly here, and that our cases could go up very quickly again. So what the picture shows is how we can prevent that from happening if we all carry on with what we're doing. And it also shows us if we only do it a little bit, the impact, and if we all are very diligent about it. And the graph shows how if we're all very diligent about uh, playing our part in preventing the spread of the infection, we really can prevent another surge from happening.
And of course, we're having some great weather. What advice can you give us about staying safe while active outdoors?
So the summer is a very special time for all of us. We look forward to it all winter. So I do encourage people to get outside and enjoy the summer. We also know that in general, outside, infections don't tend to spread as much. And that's usually why in the summertime, we don't have as many colds and things like that. So you're usually safe outside. So we do encourage people to get outside. That said, some of the things we do outside really make us close in touch with one another. So if, for instance, if you're going to go golfing, you can get pretty close to your partners. So you might want to consider wearing a mask when you're golfing. If you're going to play a game with a ball like tennis, everybody touches that ball with their hands, and so you can easily spread infection around. So try and be sure you check with your buddies that they haven't been exposed to COVID before you play with them. Use your hand sanitizer before you touch that ball, and then don't touch your face and nose while you're playing, and then afterwards wash your hands with that hand sanitizer again. So you do need to use some of the things that we've learned and think about how do these things apply to the particular activity that we're doing. But the bottom line is the summer is short, get outside while we can.
That's for sure. That's for sure. And can you tell us about your new webpage for workplaces and employers to access COVID-19 guidance, signage, and other resources?
Yeah, so we're working with our workplaces. It's a lots to learn for both us and the workplaces. Uh, Workplaces were oriented towards servicing their customers and keeping the economic engine of our society going. Their focus in the past has not been so much around infection prevention and control, uh, like our long-term care homes and our hospitals have been really good at. So workplaces have a lot to learn, and we have a lot to learn with them because we know a lot about infection prevention and control, but we don't know about how their businesses run. So we hope that by providing businesses with some of these high-level bits of information, that they can think about how they apply to each of their personal workplace settings. And so we're hoping to develop that partnership so that we can work together so that not only do they service their customers as they did before, but that we can work together with them to make sure that their work environment is safe for their employees so they don't get infection, and safe for their customers so they don't get infection there as well.
And any final thoughts for today?
I think the thing that we need to consider is everybody's mental and emotional well-being. We've all had a felt relatively tough spring, and many of us have been stressed and lonely as we've self-isolated or tried to stay at home. We do want people to keep up with physical distancing, but I think now that it's summer and it's safe to be outside, I would ask all of us to, if you've been living alone all these weeks, reach out to someone, perhaps just find a buddy, one person that you know and trust, and maybe go outside and walk around with that buddy and wear a mask and wash your hands and be safe. But let's not continue to be as lonely as we were. And if you have someone in your neighborhood who you know has been quite isolated, go out and make sure that they have someone to talk with, because we all need to enjoy the summer, not just by ourselves, but at least with one buddy.
That's great advice. Thanks again for your time today, Dr. Luck.
You have a great day, Shane.